Good afternoon, everyone. I'm Carrie Watson with the CMS National Training Program. Welcome to today's webinar on the Provider Data Catalog, or PDC. The PDC will better serve stakeholders like you who access quality, price, and volume data sets like those currently found on data.Medicare.gov. Today, we want to show you this improved portal, which will be available on CMS.gov when we launch it in the coming weeks. I'm joined today by my colleague Kim Lair, who will be helping with technical assistance, and we're very pleased to welcome Nate Mudd, the Director of the Division of Web Development from CMS, who will be leading us through the PDC demo, and also to Greg Price, the Product Owner for the Provider Data Catalog. Greg will be answering questions as you submit them in the Q&A box located on the left side of your screen. I'd like to go over a few technical issues with you now. You can choose to listen using your computer's audio, or you can mute that audio and you can use your phone by dialing in with the number provided on the left side of your screen. All phone lines have been muted so that everyone can have a good learning experience. Closed captioning is available on your screen for those who require a text version of today's training event. A recording of today's webinar will also be available within a week on our webpage, CMS National Training Program at cms.gov under the Resources tab, and we'll share that again after the demonstration. The CMS National Training Program webinar provides basic information. You should always consult the relevant statutes, regulations, and rulings for official legal guidance. Also, this call is intended as an informational call for partners. It isn't intended for press purposes and is not on the record. If you are a member of the press, please email our press office at press@cms.hhs.gov. And with that, I will turn things over to Nate Mudd to get us started.
Thank you so much. Good afternoon, everyone, and thanks for joining us. I'm really excited to share some information today about upcoming changes to the Medicare Quality Compare tools. We are making some significant improvements to the Compare tools to better help people with Medicare find information about healthcare providers and services as part of the eMedicare initiative. We want to take this opportunity to show you the Provider Data Catalog, or PDC, before our launch late this summer. The tools we're launching to support the eMedicare initiative are Care Compare, which will be on Medicare.gov for beneficiaries, patients, and consumers. And the second tool is the Provider Data Catalog, which is for data-minded stakeholders like academia, researchers, and parts of the healthcare industry like you. Now, Care Compare is a redesign of the current Quality Compare tools. Care Compare will offer patients a more streamlined compare experience, improving their ability to find information about doctors, hospitals, nursing homes, and other healthcare services from a single interface on Medicare.gov. Here's where beneficiaries and their families can go to find CMS quality data and other information that will help them make informed decisions about their healthcare. Now, the Provider Data Catalog will be replacing data.Medicare.gov, which currently serves as a repository for all the data that's displayed on the Compare tools. When we launch, you can find it at data.cms.gov/provider-data. While Care Compare is important, I'm going to spend most of this presentation giving you a preview of the Provider Data Catalog because that's where your interest lies. If you're interested in previewing Care Compare, we're planning a similar session on August 24th, and we'll announce it in the next week or so. In addition to better meeting the needs of consumers looking for healthcare information, we also want to better meet the needs of industry stakeholders like you. We search and download data that is important to you and your patients, and that's what the Provider Data Catalog will achieve. PDC will serve as a repository for all publicly reported data and will live on data.CMS.gov. It will better serve stakeholders who are interested in detailed CMS data and use interactive and downloadable data sets like those on data.Medicare.gov. On the Provider Data Catalog, we'll also make quality data sets available through an API innovators in the field can easily access CMS publicly reported data and make it useful for patients. In January of 2020, we issued a CMS blog announcing that 2 tools were being developed to improve the way beneficiaries and stakeholders access information about healthcare providers in care settings. And throughout 2020, we engaged with stakeholders to get their feedback. We also did a lot of user research, all of which helped guide improvements before launch. Once we launch the tools later this summer, we'll go into transition period where Care Compare and PDC are available to the public to use and give feedback. We will continue to make ongoing improvements to PDC, and we welcome your feedback. PDC users will be able to send their feedback by an email address on the site. During this transition period, Care Compare, PDC, and the original tools will run in parallel and maintain the same information. However, sometime later this year or early next, we'll sunset the original Care Compare tools and eventually the information on data.Medicare.gov. And we don't have that date yet. Okay, so now I'm going to jump over into the demo. So just bear with me, I'm going to be sharing my screen. Okay, so now right now you should be staring at an internet browser, and you're looking now at the landing page of the provider data catalog. I'm going to walk you through the anatomy of the page and some of the key functionality. First, you'll notice that there's a consistent global nav up top. Nothing new here, but something to call out is there is a search bar that will remain there throughout the PDC experience. So if anyone ever wants to search directly, they can go ahead and click that. On the home page in the hero image, we also have a large search box. We found through user research, many people know exactly what data set they're looking for, and we found that this is one of the easiest ways to go directly to a data set. You also have a sub-menu up here on the left. You have the home page, which we're on. You can click on data sets, which brings a results page that has every data set that we currently have. A topic section, which breaks down some important information about each setting, and then about information, which talks at a high level about the different data. Below the search box, you have a handful of icons that allows users, if they know a specific setting that they're interested in, they can click on those settings and receive, and it will return all the data sets that we have for that specific setting. And finally, at the bottom, we have some information about the how to consume the PDC's API. And like I mentioned earlier, this is a way for third-party developers to have up-to-date data specific to a specific data set, all of our data, and make sure that whenever if they're building an application or doing things with the data, that they can always make sure they have this up-to-date data automatically ingested into their tool. Now what I'm going to do is I'm going to click on one of the settings. So I'll start with hospital. You could have clicked on any of the settings and it would return a similar page. But what you're seeing over here now is the results page. And you can see right here that we're returning 73 data sets found in the topic of hospital. You notice that to the right, you have the ability to sort by date. It's date uploaded, alphabetical or relevant. You have topics, which is the settings that we have currently loaded up in the PDC. And then we have tags. And tags is more of a free-form a taxonomy that allows us to tag different data sets with frequently used words. And really this is helpful for people if they see one data set, they can find data sets that are similar to that data set. The next thing I want to show you is going into the results card. You'll have a quick summary when it's been updated, and right from the results page, you can download the CSV format of that data set. Next thing I'm going to show you is in the details page, you have a more long summary, the title, the ability to, let me get you a better data set. You have a tabular view of all the data that's in this data set, you're able to sort, filter, change the amount of rows displayed, the padding of those rows, and manage this. You can also expand it so that you can have a full screen view of that data set. In the top right corner, you have, and I'm going to jump to this page next, but let me finish the page. You can download the data set again. You can download the data dictionary, which is very helpful if people are trying to make sense of the different column names and what's allowed in them. And then it shows you the tags that this data set is part of. And then again, you can try out the data set API by going to the API documentation. We've also have some additional information here, like who's the publisher, the unique identifier, who to contact, and as well as a in-context ability to try out the API on the fly. Next one I want to show you is the topic section. You can navigate to the topic section either by using the global subnav here, or if you're already in an individual data set, you can click on that data set. I'm going to start by clicking here, but I just want to explain that both go to the same place. So on the topics names page, we now have all of our different topics. To the right, you have the ability to download archived data or download all of the data sets that we have for a specific topic. This is your easiest way to get bulk data if you want all CMS's or all data that we had on data.Medicare.gov and for the quality compare tools all in one shot. You can then click on one of the topics and you come to the topic landing page. Again, this has the same information where you can download data dictionaries, the data sets. You can learn about this government data, the archive data, and then we have additional information about all the different data that we have in the hospital topic. This is where you're going to find the meat of information specific to quality measures, what exactly those measures are, et cetera. This data was ported over either from data.Medicare.gov, but in many cases, this data was also pulled off the legacy quality tools. So this is oftentimes a home for a lot of the data when you're very interested in the different data sets. We've been working on the information architecture related to these pages so that people can find specific information that they care about and read more about the data that we are collecting and displaying in PDC. Last, we have information. This is important because, like I mentioned earlier, we are going into what we're calling a public preview, where we're going to be running the provider data catalog alongside data.Medicare.gov and the legacy quality tools. And we're very interested in your feedback. Before we sunset data.Medicare.gov and the legacy tools, we want to hear from you and let us know how this works. Let us know how you're interacting and how it's going for you. So in the About page is where you can find some information about that. Lastly, I didn't want to forget about the search bar where you can search on any topic that you're going to find specifically. So I said to Medicare spending. You'll notice that it's now returned 6 data sets that in some way have Medicare spending throughout, and you can find the one that is specific to you if you don't want to look through by setting. This concludes the demo portion of this session, and I believe I just want to thank everyone for taking the time to review the provider data catalog with us. And I believe at this time we have plenty of time to take a handful of questions if there are any.
Great, thank you, Nate. And if you have a question and you haven't had a chance to enter it into the Q&A box, you can go ahead and do that now. And then I will turn things over to Greg, who will be asking the questions.
Thanks, Carrie. Hey, good afternoon, everyone. Nate had several here and still some coming through. I thought would be good for the folks that are online. First is the provider data catalog website address.
Sure, I'll say this again, and yeah, I said it pretty quickly, and this will be coming out and be easily navigable at data.CMS.gov, as well as for a time on data.Medicare.gov. When we launch PDC, we'll be making a very clear linking strategy to the provider data catalog, but the direct URL, when it goes live, it is not live yet, will be data.CMS.gov/provider-data.
Thanks, Nate. That was asked of by multiple folks. Another question, are there multiple data loads in the current site by date? Will the new site allow you to see all available data sets and select by date you want versus using the search box and not knowing what you are getting?
Well, I'll answer a little bit of that, Greg, but you might be able to go a little more in details if you have it. There are two, we do both on the results page and the details page say when the data was up to date. The data, we choose to only show the most up-to-date data through the results page and the details page. That being said, there is archive data that underneath the topics section.
That is correct. Next question, DME. Is DME its own topic or is it included in some other topic? And I believe that would probably be under supplier directory, if I'm not mistaken.
That's correct. The data that was on data.Medicare.gov related to supply directory has been ported over, and it's under, I'm not sure if this is okay, but I can show you. It is right here under supplier directory. And here's the data. I hope that answered your question.
Thank you. Nate, while you have that there, someone did say they did not see anything for skilled nursing facility or did not see topics for skilled nursing facility. That's maybe because you just, you used a different example. You were using hospital. Just wanted to show that.
Yeah, we have nursing homes, including rehab services, and I believe skilled nursing facilities shows up under this. There you go. Yeah, so that information shows up under the nursing home, including rehab services topic. And I know that there's also a tag related to skilled nursing facilities value-based purchasing if somebody wants to search based on those information. Hope that helped.
Excellent. Thanks, Nate. Nate, you might have briefly went over this, but API, was a question about was API?
Yeah, sure. Yeah, one of our most exciting things about PDC, while the data.Medicare.gov had an API,
and I'm sorry, Nate,
believe.
what does API stand for? Sorry, what does API stand for?
Oh, yeah. Application Programming Interface. Sorry, I went right to the acronym, but yeah, API stands for Application Programming Interface, and that is, in non-techy terms, ways for someone else's application to talk to our application and share data. And so if you have third-party developers, engineers that you might be working with, and maybe they're building a website that needs our data, or a web application or a mobile app, this would be the way that they'd probably opt to consume the data here.
Excellent, thanks. There's another question here about what does it look like when you land on data.CMS.gov page. How do you navigate to provider data? But you've answered that in terms of the URL that will be supplied at a later date.
Yep.
Another, let's see. Did you go over any of the advantages, Nate, of the current, the PDC site, or list any of them?
Yeah, I hope I captured a few. So some of the other things that the performance is significantly improved with the provider data catalog over data.CMS.gov. Something you don't see, but that's behind the scenes, our back-end processes for bringing the data in has greatly been improved. Our mobile optimization, it won't be exactly to scale, but I'll show you anyway. But you'll notice that this site is built even if you're going to be coming on your tablet or mobile devices. Now, obviously, this is a data site, so we don't think lots of people will be using it mobile, but that didn't stop us from making sure that it works on a mobile and tablet device. Our Medicare beneficiary population, more and more are going and accessing the internet via their mobile device over a desktop computer. So we built that into this, and I would say that's a significant improvement. I mentioned that the API interface is a lot smoother. I think the search functionality here, kind of the findability of keywords is improved. And there's a handful of other kind of, just the overall user interface through user research has proven to be a lot easier to navigate. And then we've also opted to carry, like I mentioned earlier, we've really spent a lot of time on our content strategy around the provider data catalog and really tried hard to improve kind of the data dictionary and the data that we're kind of bringing over, making it very easy to understand the data and understand, you know, what a value is and what the column is, what, you know, where it's coming from. And so, yeah.
Excellent. Not sure if you mentioned, or there's not much information on this, but the sunset date for data.Medicare.gov.
Yeah, we haven't publicized that yet, but like I mentioned earlier, before the end of the year or no later than early next year is the plan right now.
Okay. Next question. Oh, I can answer it. There is no login access needed for the data sets on the provider data catalog. Publicly facing, there is no login needed for that site. Does this drill down to a specific facility data as well? I'm not sure if they would on this.
It depends on what that question means, but you can definitely go into a data set and find and drill down for those sets that are made up of providers. You can definitely, you know, find a specific provider. I know that many of the folks on the phone also ended up using kind of the legacy tools to kind of compare side by side. But for our data folks, this works pretty well. And for the people that maybe don't want to jump into the data set explorer, I imagine that they'll still use the legacy tool and then obviously care compare, which we're going to be talking about a little bit later. But yeah, you can definitely jump down to the provider types in both tools. One's more of a data view, and the other one is more of a beneficiary view.
Fantastic. A number of folks that joined late, a couple of questions towards that, and as you've already mentioned, the go live date, again, end of the month?
Yeah, right now we're saying late summer, and the plan right now is we're still doing some testing, so we don't have a firm date for you, but late summer right now is the planned rollout of this.
Excellent. And again, would you mind repeating that URL for folks? There's been a number of them that, again, joined late. Just CMS date.
No problem. Again, this URL is not live yet, and there will be plenty of places where it will be promoted so that people can find this without having to hard code the URL in. But the URL is data.CMS.gov/provider-data.
Okay, just reading through a couple of here. Will the data dictionary include info for obsolete fields, for example, pressure ulcers or something that is no longer being reported? And again, the data dictionaries are provided to us by each of those care settings to PDC.
Yeah, that one's a little bit farther down that I might not know the exact answer. But yeah, right now the data dictionaries are delivered over to our tool and managed by in CCSQ, the folks that are manage these measures. So I don't necessarily know if they maintain older data dictionaries when they've retired a specific field or specific data. What we may have to figure out a way to get back to you, but I'd encourage you to kind of submit that question as part of feedback, and we'd be happy to try to answer that question. I don't know the answer off the top of my head.
Right. There seems to be quite a few more detailed questions here. I'm just going through some of them here. They're very specific to file formatting. Can we download this data in CSV format? I think you showed that, Nate, in terms of the formats that they have there, please.
Yep, you can download these. Actually, CSV is the preferred format for downloading the binary. That being said, there's also an API, and then you can also bulk download the data. It's zipped up, but essentially it's a bunch of CSVs. And then the data dictionaries are PDF format. If that helps.
It's care compare replacing hospital compare. That's nothing to do with this particular site. Can you show an example of updated, improved data dictionary? I guess that's more specific to the care setting. The data dictionaries that are on PDC as of now are provided, much like they are on data.Medicare.gov, by the care setting, and that is usually in a PDF format. So we're just giving the ability basically to download that or view, as you're seeing right now. If that format needs to change, that is going to be happening from the care setting contractor doing that change.
But again, definitely interested if you have specific examples or improvements that maybe you're not seeing. We'd love to hear your feedback. You guys are really why we're building this, and definitely want to hear from you.
I mean, there are quite a few more. Again, they're a little bit more detailed. That's very specific. I think that's what I have now. I mean, there's quite a few questions here, but I think they're a little bit more detailed. Yeah, in terms of the general type of questions, I think we're good there, Nate. Right. I think we're pretty much good. In terms of the general questions, they're a lot more detailed on file formatting and finding specific types of providers or to that effect. So I think in terms of what we wanted to get across.
Yeah, so just to restate something I said earlier, but for those who join later, maybe missed it, we're looking for data parity here. So any data that was on data.Medicare.gov and the quality tools will be on this tool. And because we're running these side by side for a time, there should be an adequate time to kind of find the data sets you guys are looking for, and it should be as good, if not better, when it's related to that data. So the data existed on the old tool, it will exist on the new tool. And I'd encourage everyone, after we've gone live, to use it, and we definitely want to hear your feedback if you maybe have seen something missing, or if there's something that maybe was hard to find on the old tool, or that's hard to find on the new tool. We'd love to hear from you because we will be making iterative changes as this rolls out, especially during the window of time during when this is running side by side with data.Medicare.gov. Thank you so much. I know we're probably at time, but I appreciate everyone's questions, and we will, I think I'll hand it back over.
Yeah, thank you so much, Nate and Greg. That does conclude today's presentation. As a reminder, a recording of today's webinar will be available on our webpage, CMS National Training Program at CMS.gov under the Resources tab. And I've posted that on the left side of your screen so that you can jot that down if you want to write it down for checking back on that website. And other than that, just be on the lookout for a notice coming out soon about our Care Compare demonstration webinar, which is scheduled for August 24th at 2 o'clock Eastern Time. Thanks again for joining us today, and have a great day.